This was your disc, and we did that, that would hurt. Hey gang, welcome to my channel. Never Look Back Pain. I'm Dr. Jeff, your advanced trained non-surgical spine specialist and chiropractic veteran of 20 years. Today we're talking about the symptoms of a disc tear. The disc, first of all, is the water balloon that sits in between the bones of your back. It's made of 86% water, and there's two parts to it. There's a circular part in the middle. It's the round part right here, which is like a jelly bean with a jelly type filling on the inside with a hard shell. And then the outer layer, which is more of a cartilage type layer. And so, yes, a disc will hurt when torn, and there's two types of tears. Today, we're going to go over the two types of tears and the cause of a tear, as well as the symptoms you'll see. So let's get right to it. So there's two types of tears. The first one is called the linear tear, as you can see right here. It typically is due to trauma, heavy fall, car accident, bicycle accident, falling out of a tree. Some type of trauma that's put major force through the spine will typically cause a linear tear. And that's typically going to be the inside. That center jelly bean will tear open and it'll start to drip the chemical out, and that can cause disc pain. The second type that we see here is called a circumferential. Circumferential means circular. You see how the disc is kind of a kidney bean half circle? Well, the circumferential tear is typically due to a degenerative process, meaning your discs have been decaying over time because you haven't been taking care of them, not because you're getting older, but because you haven't taken care of them. They start to break down, and when they break down, they get weaker. The circumferential tear is just that. It goes in the circle line, so not a straight line, but it goes in the circle of the disc, and it starts to separate the layers. Typically happens over time. It's building, 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 and then what are the activities that create it? Typically it is a leaning forward and lifting. It is a leaning forward, lifting and twisting, repetitive motion of leaning and lifting, and then all of a sudden you get this pain, this ooh, that doesn't feel right. And then sometimes it goes away for a day or so, sometimes it doesn't. If it goes away, the telltale sign over the next week or two or couple weeks that it could be a tear, and this is very specific. I ask my patients very specific questions. When you lean forward to wash your face, when you lean forward to brush your teeth, you get that kink. When you go from a laying to sitting, sitting to standing, you get that oh. If you're sneezing, coughing, or bowel movement and you're exerting pressure, the pressure on the inside of the sneeze or the cough takes the disc, the water balloon, and it spreads it out. And when you spread it out, you take that tear and you separate the tear. When you separate the tear, you cause a little bit more bleeding, or you peel the scab. It's like peeling a scab. You bleed a little bit more and you cause that pain. What's the number one way to tell if you've got a tear is those symptoms and then an MRI. On an MRI, it'll show up as a white dot that you see right here. This is an MRI, and this white dot right here is a tear. That's blood. That's a tear on the MRI. So that's how we diagnose it. The symptoms plus we diagnose it with the MRI. So again, if you have been lifting and twisting and turning and you get that catch, that is the pain of a possible tear in the disc. I'm Dr. Jeff. I'm also the author of Never Look Back, a simple guide to the causes and care for back pain. If you like this video and you like my videos where I teach you about the spine and why you're experiencing what you're experiencing and how you can solve it, go to neverlookbackpain.com right now. For $20 some odd, you can purchase this book. This book is a simple guide. It's a small, simple guide to help you understand what is a normal back. Why are you having the pain you're having? To understand the 5 ways that people unknowingly hurt their backs every single day and the 5 ways to prevent it, including the gym. We talk about the tests that your doctor should be running right now, regardless of insurance acceptance or not, to find out what your diagnosis is to help you get on your way. And we talk about simple ways to help your back pain get better non-surgically. Again, go to neverlookbackpain.com. It's for $20 some odd. It'll save you thousands of dollars. I'm Dr. Jeff, excited to get rid of neck and back pain, because when you finally get rid of the injury called a disc injury of neck and back pain, and you get rid of neck and back pain once and for all, you praise God, you never look back. I hope you like this channel. If you do, hit the subscribe button below. Help me get on a movement of changing the world, getting rid of neck and back pain non-surgically. I'm Dr. Jeff. Have a great day.